If you weren't with us last hour, you missed a great interview with Dr. David Feinberg. He's the CEO of the UCLA Health System, and he put in perspective the whole problem of what we're doing and trying to give affordable health care to so many people. You can only do so much, but if you've got a population that is getting worse off physically, then the cost is going to go up no matter what kind of containment you put in Washington, D.C. Very disturbing study came out just this week by the Trust for America's Health and the Robert Wood Johnson Foundation. Came out and showed that Americans are getting much more obese than they were in the past. This is really startling. Listen to these figures on this. 15 years ago, the state with the highest obesity in America was Mississippi, our friends in Mississippi. 20% of the population were dramatically overweight. Not just a little overweight, but dramatically overweight. 20%. Today, the best state in America is Colorado. They're 20%. The worst state, Mississippi, now is almost 35%. The point I'm making is that we've gone from the worst being 20% to the best being 20%. What that means is every year we're averaging about a 1% increase in the huge number of obese people in this country, and the cost is just astronomical. Good column in the McLuhan report that came out this week. Here's what David Stipp says. Don't blame all senior citizens for causing Medicare costs to skyrocket. He says, blame the obese. In the ongoing debate about Medicare, pundits and politicians often succumb to the mass hallucination that by living longer, old people run up big medical bills. In reality, people who are healthy at age 70 live an average of 14 years more, spending less than $10,000 a year. The real cost, here's the point, the real cost threat to Medicare comes from people who enter old age with serious weight problems. In the past, obesity doomed you to an early death, but today, cholesterol-cutting medicine, diabetes drugs keep unhealthy people alive into their 70s and 80s at an enormous cost. If you want to trim the health care budget, you got to do something about obesity. Now, I'm not for the government setting standards in what you can and can't eat. I don't want the food police getting into my life. Having said that, I don't want to pay for someone else's irresponsibility in taking care of themselves. If you're going to get on the public dole with food stamps, with Medicaid, even Medicare, and I'm on Medicare, then there ought to be some standards. And I got no problem with telling someone on Medicaid, for example, look, you got to have an annual physical. Okay, the doctor says, I got to tell you, you're about 25 pounds overweight. It's not helping your heart. You're prone to some other diseases. You got some problems anyway. You got to lose weight. Next year, I want you back here. I want to see some improvement. Next year comes back, the patient comes back next year. They're either the same or even worse. Well, should you and I keep paying for that? I don't think so. I shouldn't be paying for the health care for that kind of person that shows no responsibility in taking care of themselves. I think if you come back, the doctor ought to say, look, I'm going to give you one more chance now. I told you last year. Next year, if you come back without some significant improvement, you're not going to get free Medicare. Or if you get it, you're going to pay a lot more, you see. Smokers ought to pay a lot more. I shouldn't subsidize smokers. I shouldn't have to pay for that, and you shouldn't either. So that's part of the debate going on in terms of how we get a handle on these outrageous costs. And I think there ought to be some standards. No food police if you pay your own way. Now, I don't think Medicare completely is me being on the public dole. I paid into Medicare all my life. I paid in a couple of $100,000 into Medicare. If I would have invested that money, today it'd been worth $400,000 to $500,000. So Medicare, I want my benefits on Medicare. Having said that, if some standards are set based on public funds, giving you food stamps, giving you Medicaid, where you get the health care for free, going to the charity hospital, getting health care for free, I've got no problem with that patient being told, we're going to give you a baseline. Here's the improvements you've got to make. If you're not along that way, then you've got to either pay more or you don't get the benefit. I think we've got to draw the line on these outrageous costs. If we don't, we're just going to see the budget grow and grow. Congress obviously doesn't have the will to cut back on Medicare, Medicaid, these programs. They talk and talk and talk and do very little or nothing. We've got to put a better implementation in place. I think it can make a difference. I think it can save a lot of money. That Freiberg book, by the way, is on my website, JimBrownUSA.com. That's www.JimBrownUSA.com, called Prescription for Excellence. I read it over the weekend. Great book about taking care of yourself and how you get a handle on the costs involving medical benefits in this country today. We'll be right back.